Good afternoon, everyone. Thanks for joining our daily health department update today. The number one issue that we're hearing about, at least at City Hall right now, is when can we go back to where we were? How can we get businesses opened up again, etc. Illinois had over 1,500 new cases today, and projections are that we may not hit the peak until mid-May. We know that many small businesses are literally on the ropes right now, and guess what? So is the city. Not only did many small businesses not get in on the PPP, the federal government hasn't allocated one dime to local municipalities either. The only cities that got assistance from the federal government were the 30-something cities with populations of 500,000 or more. I've personally talked to Representative Bustos, Representative LaHood, and Senator Durbin's chief of staff about this, and they know something has to be done before the majority of the cities in this country literally implode. And I'm not being dramatic. That's where we are. In Peoria, we're having a special meeting tonight to figure out how to cut $40 to $50 million out of what was already a bare bones budget. That's the desperation that we're looking at right now. But back to reopening the economy. I implore you, please don't blow it now. Our community has been very vigilant and overall done a very good job of maintaining the social distancing to keep the COVID virus contained in this area. We had a new testing site opened up today with 2 more coming online very soon. And this is going to give our community a lot better idea of what the health is in our community or not. So it's really important that we all remain vigilant. We all want to get things going again, but we have to be very vigilant and very careful about that. I ask you to seriously help us in these measures so when the governor does look at potentially opening up certain regions of the state that show that they're ready and prepared to do so, that Central Illinois is part of that group. On behalf of Chairman Rand, Chairman Zimmerman, and Chairman Krug, we appreciate everyone listening in on these daily meetings. We're trying to get you as much information as we possibly can so we can get back on track, and we appreciate your participation. Now, Monica Hendrickson.
Thank you, Mayor Ardis. Usually I begin these daily briefings with updated counts, but before getting to that, I think it's really imperative to also focus on what the mayor spoke of about understanding that we want to be prepared to, when we do reopen, what does that mean? There's been a lot of information talking about the number of cases we have in our region, how low it is, and possibly meaning that we don't have that big of a problem. But I want to take again that opportunity to focus on the fact that the cases we report are our confirmed cases. It is not those that are presumed, meaning individuals that we know by their symptoms and their contacts are most likely also positive for COVID. And it doesn't also count the individuals that are currently we're monitoring for contact tracing based on locations. So to put in perspective, for every positive test that we have confirmed, we at least have anywhere from 2 to 3 close contacts that are presumed, as well as monitoring on average 15 other individuals for symptoms for the next 14 days based on their contact with that one person. So the numbers we report are very much a small percentage of our population. So it's not that we don't have a problem here locally. It's the fact that what we report on is one data point, but there are a multitude of data points out there. And with increased testing, that confirmed number will keep growing as it expands. So to begin with, for our 2 date totals as of Tuesday, April 21st, the Tri-County has 81 total confirmed cases. That's an increase of 4 from yesterday. Peoria County has 44, Tazewell County has 26, and Woodford County has 11. We're also very sad to report that Woodford County reported their first death related to COVID-19. It is a woman in her 70s who passed away on April 20th from complications related to COVID-19. She had underlying medical conditions and based on recent travel as well as contact to a known positive.
Sorry, what?
She had recent travel as well as contact to a known positive. In regards to the hospital data, the hospitals of Unity Point Health, Methodist, Proctor, and Pekin, as well as OSF St. Francis Medical Center, are reporting today 19 ICU beds in use, of which 12 are persons under investigation, 7 for confirmed cases of COVID. In terms of non-ICU beds, there are 24 in use. Again, we're seeing, since we started reporting this a few weeks ago, that overall our bed capacity still ranges in that 40 to 50 bed span. Again, wanting to reiterate what the mayor said about making sure we're doing it right and continuing to do so. In regards to further demographic data, I want to share that for Peoria County, of the 44 positives that confirmed that we have, 61% or 27 are recovered, 8 are at home and isolating, which is 18%, and 7 are currently hospitalized, which is 16%. 59% of our positives are female, and the 3 age ranges with the most cases include those 50 to 59, 60 to 69, and 30 to 39. Whites make up 66%, and Black African Americans make up 25% of our cases. Today also marked the opening of Heartland's East Blufford, Wisconsin test site. And after discussing it with the director of Heartland Health Services, as of 2:45 today, they had completed 135 tests. The Heartland Health Services Clinic on Wisconsin will continue to do tests from Monday through Friday from 9 to 4, as well as Saturday from 9 to 12. The Peoria City County Health Department site will become operational this Saturday and will be serving Saturday and Sundays only from 10 to 2. And beginning next week on the 27th, the third site, which is the Peoria Park District's John Gwen Jr. Park, will open up their testing site as well. As we continue through this discussion, we focus a lot about the physical health issues that arise from COVID-19, but we also want to continue to shed light on the mental health support that needs to happen. So really pleased to introduce licensed clinical social worker from Heartland Health Services, Christy Tomashevsky.
Thank you, Monica. Good afternoon. I'm Christy Tomashevsky, a licensed clinical social worker with Heartland Health Services. The COVID-19 pandemic has brought many changes to our lives and the lives of our loved ones. Altered routines, uncertainty, financial difficulties, and social isolation. These worries can be overwhelming at times and have a negative impact on our mental health and on our well-being. During this time, I encourage you to focus on what you can do, no matter how small. Maintain a routine, connect with a loved one, and be kind to yourself. While the current situation is stressful for everyone, Heartland Health Services is aware of the health disparities and mental health concerns in the communities that we serve. We have 3 licensed clinical social workers accepting patients at our Carver location, East Bluff location, and Garden location. We can assist with a range of difficulties, anything from depression to anxiety, any life stressor, and a range of age groups as well, so children, adolescent, adults, and families. We're committed to serving the individuals with the greatest needs. We are also now seeing patients through telehealth. If you would like to schedule a session through the convenience of your own home, we can do so either via Zoom or even over the phone. We can schedule therapy as well. We're here to help. You can call Heartland Health Services at 309-680-7600. I'm asking you to look at this as an opportunity to reduce the stigma that typically surrounds mental health and to reach out for help. I am confident that we can find strengths during this difficult time. Thank you.
Thank you, Christy. Our next speaker has really been pushing not only Peoria, but what it means to really expand the scope of healthcare in our community. Please introduce Dr. Vozenilek, Vice President and Chief Medical Officer of Innovation and Digital Health at OSF Healthcare.
Thank you very much for having me. We'd like to give every member of our community every option to participate in our program known as the Pandemic Health Work Program. This is a telehealth program. It digitally and virtually connects clients, patients of the program to our healthcare services in a layered approach. The phone number to reach out to become enrolled in this program is 833, the letters OSF, KNOW, OSF no, 833 OSF no. This is a layered approach, and I say that very deliberately because we do provide materials to each person who's enrolled in our program in terms of a manual and access to digital applications which keep a person connected to us and well. But it's backed up by a series of nurses and providers, APPs, and physicians who can provide services as needed. And then behind that layer, yet further, is a layer where if a person becomes sick and they're in their home and being monitored by this program, that patient, that client, can be connected to advanced services as needed. The strategy in general is to have people who can be cared for at home. We recognize that this virus has come to us in many forms, but the vast majority of patients will be convalescing in the comfort of their home, maybe feeling unwell for a period of time, but then recovering well and don't need admission to the hospital. We'd like to reserve those hospital beds for those who truly require them. It's important to note, and I congratulate our prior speaker, in regards to behavioral health services, there are behavioral health services that are also available through telehealth digitally by enrolling in this program. A program called Silver Cloud is partnered with us for behavioral health monitoring and support. And I really want to emphasize very much for each of you who are listening to understand that this program is offered to you free of charge through the Department of Healthcare and Family Services, the state of Illinois. It was announced by the governor of the state on the 11th of April. He announced it again a few days ago. And we do find ourselves in a position over time to support the recovery of the economy by keeping connected to patients and letting them know how to care for themselves and how to adhere to the good guidance that's coming out of offices like this across the state of Illinois. I will add one further statistic for you all to think about. There are currently 184 patients from the Peoria and Bloomington area that are already enrolled in this program and already giving us excellent feedback. This is a program that's available across the state of Illinois, but our impact here locally is very heavy. We'd like to see a lot more patients becoming enrolled in our program, and we have capacity to serve each of you as needed. Again, if you're feeling the symptoms of COVID, you want to talk to a nurse, our screening can create a situation where you're enrolled in this free program. The number is 833-OSF-KNOW. And we're welcome you to interact with us as soon as it becomes necessary. So please do reach out. Thank you.
We'll open up to the speakers. Are there any questions for any of the speakers?
I got a question for you. You might be able to help me out with this. We had reported that another resident at the Bickford Assisted Living Home has passed away. Can you confirm that?
I can confirm that the two deaths that were associated to Peoria County were related to Bickford House.
Was the Woodford County death related to an assisted living or long-term care facility?
So the question is, was the Woodford County death related to a long-term care facility? And the answer is no, it was not. The individual had been taking care at home, but symptoms progressed and then was admitted to Broman.
Monica, have we seen any other outbreaks in any other long-term care facilities in Peoria?
Currently, in terms of outbreaks in our community, Again, I would direct individuals to the Illinois Department of Public Health's website, which does have an active link monitoring for every county, all the long-term care facilities that are currently having an outbreak. For Peoria County specifically, it's still the 3 locations of Bickford House, Sharon Willows, and Generations of Peoria. All 3 of which I want to just again express gratitude for their staff working in coordination with not only the Peoria City County Health Department, but the Illinois Department of Public Health. It's a very difficult situation. They work with a high-risk population in a congregate living setting that really is that vulnerable population. And so they've, ever since COVID really started approaching in Illinois, they've been working tirelessly to protect their staff and their residents, and we appreciate all the hard work they've been doing.
Can I just get some clarification on how many tests are available at the Heartland testing sites? Because last Friday, Ms. Adams said 150. Yesterday, I believe he said 100, and today it was 135 as of 2:45. So how many tests are actually available?
So it does range. We are hoping to have 150 per day is the understanding from Heartland Health Services. Again, that's based on what supply they have available. So right now, they early in the testing, they are testing at 150. However, for individuals that are going to possibly use these testing sites, be aware that they are going to make sure that they are properly counting, knowing what their capacity is. And so you might not be seeing them one day, but definitely come back the next. We want to make sure we get as many people as possible tested.
And how are most of the people who are coming to get tested using it today? Is it drive up, walk up, or are we seeing a lot of both?
So the question is in regard to the East Bluff site for Heartland's testing, where they actually seen majority of individuals were coming in vehicles, in personal vehicles. So very, very few walk-ups.
Has the process been pretty orderly and fast to get through so far?
And the questions about how the process is going, Heartland Health Services has done a lot of planning, and applaud them for taking a lot of considerations and partnering with the city and having the support of the city in terms of traffic and all that as well. And so it went really smoothly, and I think the best indicator is the fact that individuals were well informed, they understood the process, and they got really great feedback from the clients themselves.
Are antibody tests taking place right now in the area, and if so or if not, is this something that can happen through drive-through testing?
So the question is if antibody testing is available in the area. To my knowledge, that we do not have any local antibody testing available. And I want to make sure people recognize the fact that there is a lot of dialogue about antibody testing. It's going to be very important to understand from a surveillance standpoint communities' immunity, so to speak, towards coronavirus or COVID-19. The issue is that the FDA has really only approved 4 tests, to my knowledge, through emergency utilization for specifically antibody testing. And so really, our healthcare providers are fully aware of it. Our universities are looking at it as well, but they want to make sure that they're not bringing forward a test that would create false positives or false negatives.
And my question, it might be for you, Monica, or it might be for the mayor. I'm not sure, but I'll go ahead and ask it. But the 5 correctional officers coming back, who are Olin River correctional officers out in Canton, who are coming back from Stateville. I know there's been some controversy over whether or not they've been promised testing and paid quarantine. I know the health department and the cities can't do anything about paid quarantine, but has there been any talk about taking advantage of the East Bluff testing site to provide those 5 volunteers that much?
I'm not fully aware of that story, or I don't know if the mayor as well. Not to our knowledge, but I think the important understanding is that our testing sites that are available are for the individuals, those 4 categories that, again, from a risk categorization, they are individuals that have symptoms that live in temporary shelter, those that have consistent or known exposure to a positive test, individuals of older age with chronic health conditions, and those frontline workers as well. The key, though, is because of the type of testing that we're doing, symptomology is important. Those symptoms, again, include fever, cough, shortness of breath, chills, muscle pain, headache, and sore throat. So if you are presenting any of those symptoms and would like to be tested and you meet those priority groups, those Heartland Health Services is going to be a great option for our community to have.
Is it possible that rapid testing might miss infections?
Rapid testing might miss infections. I think the question is really more about understanding what testing we have available and the process it goes through. Outside of a pandemic, when we do any type of testing from a healthcare community, it goes through a stringent process through the FDA. There are epidemiological studies that look at it to make sure, that the efficacy is truly there. And so one of the concerns is that when you have a lot of tests that promise a lot and flood the market, they may not necessarily be the best. And that's why I, again, applaud our healthcare community in our state to doing the due diligence to make sure that when they were looking at tests, they were making sure that they were consistent. They had initially when we started doing testing, we were actually collecting 2 samples to actually have a reference lab test to see how much they were both coming back the same result. And so again, I know there's a lot of news out there about the different types of testing available, but make sure you do talk to your healthcare provider. And our 2 healthcare systems, as well as our federally qualified health center, have been working diligently to make sure we have good testing here in our community.
Talking about the testing a little bit, Pastor Marvin Hightower had mentioned last week that certain people in the city didn't have access to testing, and now we've got a new one open today. There's going to be another one open next Saturday, Saturday and Sunday, and next Monday. Do we have any demographic information on who's being tested, and is that something that we could get going forward as well?
So the question is about understanding who's currently being tested. The Peoria County Health Department website actually has created a GIS dashboard, which both looks at demographic data by gender, age range, and race for both tested populations and our confirmed cases, as well as zip codes. I appreciate what Pastor Hightower was emphasizing during that discussion, and I think it speaks well to even what Representative Jahan Gordon Booth mentioned when she presented the briefing, that having this dialogue for weeks on hand prior to kind of bring testing not only to Central Illinois but to our high-risk populations. And so I applaud her efforts as well to bring that here locally.
So I know we talked a little bit yesterday about what, from a public health administrator perspective, you'd like to see to potentially be rolling back some of the restrictions currently in place. I mean, the governor's talked about a potential regional approach, as has been alluded to a couple times today. I guess what I would like to know, and I think what people in general would like to know, is what kind of benchmarks or signs are you looking for to potentially start a regional rollback of stay-at-home restrictions here in Central Illinois?
So the question being, what kind of data would we want to see to kind of understand where we sit as a community to start relaxing some of our restrictions? And it is really difficult to pinpoint one data point. I think it's a story of a lot of data points. Our speakers even presented the fact that telehealth usage, right now I believe is over 100 individuals are using here in our region the pandemic healthcare worker system, which is a great resource that we have available. But that 100 is not necessarily the same 100 or the 81 as a regional that are getting tested positive. And so we're going to be collecting data from a multitude. It's going to be those that have confirmed tests, those that are using telehealth services, ICU usage, as well as even our police department, our fire department, EMS services, their call volume. All of that data is really what we're going to be utilizing to make understanding where we sit as a community until we have better surveillance, such as antibody testing available. So in terms of what I would like to see is, I think we still don't have enough testing locally here, and today's test site, as well as the ones that are coming online, are just one step in getting that information. I still think it's too soon to think of relaxing any type of restrictions. I think it needs to be a phased approach, and understanding that, again, it's not going to be a yes, no, but it's going to be very much a gradient that we're going to see.
So if the 3 Heartland sites are online, they're doing around 450 tests every day they're open, and plus whatever private testing or testing in the hospitals or elsewhere might be happening. What would be the level of testing we would like to see here to potentially start thinking about this?
So the question is, what is the level of testing we'd like to see? And I don't necessarily know if we need it's a level of testing, but understanding the fact that when we do test someone, that's a point of time test. So when you get tested today, you know your status of COVID-19 as of today and the time you took the test. But we are still learning more about the fact that asymptomatic people can transmit it as well. And so I don't necessarily know if it's general population testing that we necessarily want to just pinpoint, but also those high-risk vulnerable populations, our congregate living settings, and understanding how their staff is testing routinely. So it's not number of tests, but just overall capacity of tests to run it consistently. Because again, it's only a point-in-time test.
So is getting tested one time is not enough?
So the question is, getting tested one time not enough? It'll tell you what your status is for COVID-19 at that point in time. If you come back negative, that doesn't mean that you're negative forever. That means you're negative at that point in time. You can still contract the virus later on, or also be transmitting it to others if you're an asymptomatic individual.
Monica, you happened to mention that you wanted to talk to fire and cops and to AMT as part of this to see how the virus is spreading. What is the level of call? Because, I mean, we can have a lot of folks who are positive, but we still don't have a lot of people in Proctor, OSF, Methodist, or Pekin, and we certainly don't have a lot of people in the ICU bed. So the question is, which is the bigger stat that I'd like to know? Number one, what is the level of calls? But what is the more important thing? Is it the number of people who go to the 4 area hospitals, or is it the number of overall positive cases?
So the question being, which is really the stronger data point? And there is no one magic number. In terms of the dispatch call volume, Dave Tuttle was actually speaking last week as to part of this, and what they did create in conjunction with the 2 EMS providers in our area is this pandemic card, where they actually will tag a resident or a call based on what the symptoms were. And they've seen consistently about a dozen of those calls each day. So we know that the community's transmission still exists, especially since we're no longer in the historical influenza season. In terms of the ICU numbers and why we're kind of monitoring that is because, again, as our speakers mentioned, the question really isn't about an individual getting sick and whether or not they're sick and it's their health. It's the community level as all. We only have so many beds in our ICU, so many vents. And so the goal of this entire response effort, and why the mayor, I think, said it really well, which is we're in this for the long haul, this is a community response, is because you do not want to inundate a limited resource such as an ICU or event really quickly with a lot of people at once. You want to spread that out, and the best way to do that is to decrease transmission, and that is why those non-pharmaceutical interventions are really important. I think our speakers reiterated the fact that telehealth, using those services, are a great means to gauge your health and self-quarantine or self-isolate yourself depending on your symptoms, and really wanting to keep those limited resources available for our most critical care. Having said that, we don't want to slam it all at once. We want to make sure we spread that out, and that really has always been our primary objective in this response in terms of it.
But is it, and that's the whole concept, ma'am, of flattening the curve.
Exactly.
I get that, but haven't we kind of, if we did suddenly open up now, let's say, or next week, whatever, aren't we really, for most of us, right back to where we were in the middle of March, where the vast number of us are probably not infected, have no immunity or defense, and there's no treatment for them? So the question is any level of reopening just asking for another spike, absent of a treatment or absent of a vaccine?
So I think you make a great point. The question really being is that without having a vaccine or having a treatment plan, when will we know that we are really back to normal? And that's really going to be what I think the mayor spoke about, is that we don't want to lose sight of our community's response. We want to make sure we're protecting our vulnerable population. And so we're never going to go back to baseline previously. We're going to see a new norm, and that's so that we can relax those restrictions in a process that assists with our economy, assists with us kind of moving forward, but always monitoring those values. And I think that's really key. And so one of the biggest concerns, I think, as a healthcare community that we always see is that if we relax it, how quickly can we respond back and close back down? And we don't want to make that decision. I think it's going to be a hard decision to do. And so we want to make sure we do our due diligence so that when we open up, we do it in a way that allows us not to flood our capacity of our healthcare system, but in a way that can be done meaningful and slowly, so that we can get to some semblance of normalcy.
But are you worried, ma'am? Because as of right now, the area, as Mayor Ardis said, has done a pretty good job with it. But if we do slam back down in August or later in the fall, are you worried that if we keep this going for too long, people are not going to do it because you're going to lack any type of credibility, because they're going to be looking around and saying, it's not that bad here, so why am I going to do it then if you made me do it now?
I think that's always a concern that public health has, because I think we see this as a restriction versus what it is. And it is a actual health-driven intervention. It is a non-pharmaceutical intervention that we're doing. It's the fact that as a community we prescribed to ourselves the fact that we needed to do social distancing to protect our vulnerable populations. I also would like to make the argument that number of cases of polio in the U.S. is very small, almost zero. Does that mean we argue that we lift vaccination programming? No, it's because we were able to do those interventions to effectively control a virus, control a disease. And so again, this is not meant to be some restrictive policy, but rather we prescribed as a community for the health and safety of our community to take care of each other and commit to doing the social distancing. And hopefully if we do it well and we commit to doing it well, that we can find a solution sooner than later.
I know you said that just because you test negative once doesn't mean that you'll always be negative. You also mentioned that we're not exactly where we want to be with testing. Are there any restrictions to testing or drive-through testing? For instance, if you get tested, you test negative, you want to come back, is there a certain amount of time in between there? Do you have to show symptoms? Or do you show symptoms both times? Can you just kind of explain that? Do you have free will?
Can you continuously get tested if you keep coming negative as a test? The biggest indicator of testing really right now is that, one, the availability of testing, but secondly, that you need to be symptomatic for the testing process that we utilize currently. And again, we want to make sure you have a viral load so that it does actually give you a true result versus a false positive or false negative. But I would really highly recommend individuals that think that they have tested and it comes back negative and their symptoms are still progressing to really talk to a healthcare provider. The services that were outlined today by both Heartland and OSF, Union Point likewise has one, is this telehealth services, and that's a way for you to link to a healthcare provider who knows your medical history or can walk through your medical history and recognize, the fact that what you need in terms of additional testing, or maybe there's something else going on. And so again, communicating with your healthcare provider is going to be, in those instances, a great resource.
Monica, there's been a lot of talks recently about the peak. You keep talking about hospital capacity. We don't seem to be quite at the full capacity yet, but where are we at the peak right now?
I think in terms of where we are in the peak being the question is both the governor and even the mayor of Chicago discussed this a little bit, and we're really looking into mid-May right now. And the reason why is we've seen a lot of cases in the Chicago area and not so much in central Illinois or even southern Illinois. And right now there's now 90, I think the count is now at 96 out of 102 counties that are now to have cases, and they grow substantially. Our neighboring county, Henry County, comment on the fact for their size, they have a lot of cases compared to some of the larger counties. And so I still think that we are still progressing on the curve up. We haven't hit our plateau or peak. And so I think mid-May still looks like where we're going to land on this.
One of the things that I'd like to ask you, in the past, whenever people in this nation have been asked to confront something, the basic the response is to push through it, to fight back, to try to keep living your life. What you're basically asking people is to do the exact opposite of this. In terms of a mental aspect, how difficult is it to try to change the national or even the local psyche in a matter of weeks?
So I think I actually would disagree with your statement, a statement being that people will push back on that response. I think overall, I can speak for Peoria because you see it every day, and especially in this response, you've seen it. You can talk about it from the state and even the nation. Is that as a community, we understand our responsibility to each other, and so in this response effort for here locally between the city and the county, our community partners that have stepped up have done so in a way to really look at protecting the community as a whole. So I would argue that it's not necessarily pushing back. I can only speak for Peoria and what I've seen, but in our community, we've had some great community partners that have stepped up and said, how can I help? How can I move this forward? And it starts with great leadership, and I think Mayor Ardis and Chairman Rand for Peoria have done a great job, as well as their counterparts in Tazewell and Woodford. And so I think I would disagree and say that as a community, we've actually embraced the challenge of taking care of each other. Okay. Well, with that, thank you so much for attending, and we will be back again tomorrow.